When a person attends a health facility, healthcare professionals must differentiate between physical and mental health concerns accurately. This process ensures appropriate assessment and treatment. Many conditions can manifest with overlapping symptoms, such as fatigue, dizziness, or chest pain. These may stem from either a medical or psychological cause. A thorough assessment, including medical history, physical examination, and mental health screening, helps identify the root cause and prevent misdiagnosis. Recognizing this distinction is essential. It allows for timely and effective treatment, reduces unnecessary interventions, and ensures patients receive the right support, whether through medical management, psychiatric care, or both. A well-rounded approach benefits both patients and healthcare teams by improving outcomes and fostering a more holistic understanding of health. The 5 Ps, a critical checklist before a mental health referral. Before making a mental health referral, consider a critical checklist. Let's call it the 5 Ps. These 5 factors can mimic or contribute to mental health symptoms. Overlooking them may result in misdiagnosing a medical condition as a psychiatric presentation. Beyond this, we must also ask key questions. Why this person? Why now? What actions need to be taken? In this discussion, we'll break down the 5 Ps, examine the connection between intoxication and psychosis, explore the impact of personality disorders and suicide risk, and distinguish between delirium and delusional disorders. Let's begin. The 5 Ps to consider. P. Urinary tract infections, UTIs, especially in older adults, can cause confusion, agitation, and even hallucinations. What might seem like a sudden onset of psychosis could be a treatable infection. Identifying infection before assuming a psychiatric condition is crucial. Pain, whether acute or chronic, pain affects more than just the body. It profoundly impacts mental well-being. Persistent pain can lead to irritability, depression, and even suicidal thoughts. Before making a mental health referral, ask, is this person in pain? Addressing discomfort can greatly improve mood and cognitive function. Poo, severe constipation, particularly in older adults, can cause discomfort, confusion, and agitation. A sluggish digestive system can impact overall well-being. What appears to be a sudden cognitive decline might simply require effective bowel management. Pus, could an undiagnosed infection be the cause of these mental status changes? Conditions like sepsis, pneumonia, or even an abscess can present with delirium, confusion, or paranoia. A full medical assessment, including infection markers, is essential before attributing symptoms to a mental health disorder. Pills, medications, and drug interactions can mimic psychiatric symptoms. Drugs such as benzodiazepines, opioids, anticholinergics, and steroids can cause confusion, mood swings, or hallucinations. In older adults, polypharmacy increases this risk. A thorough medication review is key to preventing misdiagnosis. Additional considerations: PIST and personality. PIST, alcohol or substance intoxication. Alcohol and drugs significantly impact perception, mood, and cognition. Intoxication or withdrawal can mimic mental health conditions, leading to paranoia, aggression, or hallucinations. It's important to rule out substance use before diagnosing a psychiatric disorder. Personality disorders and triggers. Personality disorders, such as borderline, narcissistic, or antisocial personality disorder, often emerge during a crisis. These people may have long-standing patterns of emotional instability, unstable relationships, and heightened distress. Psychosis, a true psychiatric emergency. Psychosis involves a disconnection from reality, often marked by paranoia, hallucinations, delusions, or extreme disorganization. While conditions such as schizophrenia, bipolar disorder, or severe depression can present with psychosis, it is vital to rule out medical causes first. The key question is, why now? What has triggered this crisis presentation? Changes in behavior are not random. They reflect an unmet need. Aggression, withdrawal, or self-harm often signal underlying issues. Common triggers include medical conditions, emotional distress, environmental factors, unmet basic needs, e.g., pain, fear, lack of sleep, hunger, dehydration, or homelessness. By identifying the root cause, we can take a proactive approach, addressing the issue rather than just the behavior. Assessing suicide risk. Suicidal thoughts must always be treated with urgency. When assessing risk, it's essential to gather collateral information, including historical data, substance use factors, psychosocial stressors, Pain, both chronic and acute. Key questions to evaluate. Do they have a plan? Specific plans indicate higher risk. Do they have intent? Are they actively considering acting on their thoughts? Do they have access to means? Removing access to lethal means can prevent impulsive actions. Suicidal thoughts are not always associated with psychiatric conditions. Often, they stem from situational crises such as pain, grief, or loss. Identifying and validating these triggers allows for better management of an individual's risk status. Delirium versus delusional disorder. Delirium develops rapidly, within hours or days, and fluctuates throughout the day, often worsening at night. Symptoms include altered consciousness, reduced awareness of surroundings, inattention, difficulty focusing or shifting attention, cognitive impairment, confusion, disorientation, memory issues, disturbances in sleep, activity, or emotions. Delirium is typically reversible with early diagnosis and treatment. It is often caused by an underlying medical condition, substance intoxication, or withdrawal. Delusional disorder presents differently. Delusions are fixed false beliefs that persist despite contrary evidence. Individuals with delusional disorder have normal consciousness but are preoccupied with irrational beliefs, often leading to unusual behavior. Common delusions include persecutory beliefs, thinking someone is trying to harm them; grandiose beliefs, believing they have special abilities; erotomanic beliefs, thinking someone is in love with them; jealous beliefs, suspecting a partner of infidelity. Understanding the key differences between delirium and delusional disorder is critical for proper diagnosis. Misidentification can lead to inappropriate treatment. A holistic approach to crisis management. When assessing a person in crisis, ask, why this person? What is their baseline mental state? Do they have a history of similar crises? Why now? What triggered this episode? Are there medical, social, or environmental stressors? What needs to be done? Do they require medical treatment, crisis de-escalation, or psychiatric assessment? Addressing these questions supports a holistic, person-centered approach. Before considering a psychiatric referral, a full review of the 5 Ps, behavioral factors, and possible triggers ensures a more accurate and timely intervention. By looking at the whole person and their unique circumstances, we can improve outcomes and support recovery more effectively. Final thoughts. Thank you for watching. We hope you found this video insightful and helpful. If you enjoyed the content, please like this video, subscribe to our channel, hit the notification bell so you don't miss future content. Feel free to share your thoughts in the comments below. Let us know if there's anything else you'd like us to cover. Your support helps us continue creating valuable content. See you next time.